IVs will need to be removed eventually. Sometimes an IV will go bad and no longer function properly. In that case, we want the non-functioning IV removed immediately. You never want to risk someone attempting to give medications through a non-functioning IV. Other times, the IV may no longer be needed. Either IV treatment is complete or the patient is being discharged. Whatever the reason, the steps to remove an IV will be the same, and it's a relatively straightforward process. Begin by collecting your supplies. You'll need alcohol swabs, or chlorhexidine swabs would work as well, tape, and a small stack of 2x2 gauze pads. The first step is to remove the adhesive dressing. This is arguably a more painful experience than placing the IV, so take some time to make this as painless as possible. Take an alcohol swab or chlorhexidine swab. Peel a corner of the dressing up and scrub under the dressing with the swab as you lift up on the dressing. It will help to neutralize the adhesive and allow the dressing to lift off the patient more easily, without pulling as much on the skin or hair. When you get close to the catheter site, peel up all sides surrounding the catheter, but be careful not to pull out the catheter just yet. This example shows the IV advanced dressing, but removing with alcohol helps with the removal of most adhesive IV dressings. Once you've got the dressing up, step 2 is to take the gauze pads and fold them twice down the center to make a small square of folded gauze. This will act as a pressure dressing when taped over the IV site. Then get an appropriate length of tape ready. Hold the gauze over the entrance site and smoothly pull the catheter out. Press the gauze down and tape it in place. You have successfully removed the IV. There will likely be some bleeding from the site following removal, and the dressing should remain in place until bleeding has stopped. It shouldn't take too long, but in general, if you wait an hour, the dressing should be able to be removed, and patients being discharged should be told that information as well.